Hi, it's Dr. Keenan. Are you struggling with weight gain or infertility? And you might be wondering what's going on. You're told maybe that the birth control pill is your only answer to help to regulate your periods. Well, today I want to talk a little bit about polycystic ovarian syndrome. And it's not just me speaking about it this month. There actually is a month dedicated to PCOS awareness. So why do we really need to talk about this condition? Well, number one, over 70% of cases of PCOS get undiagnosed. And it's a very common disorder. It's one of the most common endocrine disorders of women in their reproductive years. Up to 1 in 10 women can have issues with polycystic ovarian syndrome. So why is it important that you need to know about it? For most women, number one is infertility, because most women don't know they have PCOS until they try to conceive and get pregnant. And then they try to have a baby and they have to go to a hormone clinic, whatever it may be, to help them with their conception. Because what's happening with PCOS, we still don't understand the complete mechanisms of why this happens, but the brain is not releasing the signal so that you ovulate on a regular basis. So how does this show up in your body? You have irregular periods. Some women, their periods can be 3, 4, 6 months. Some women can go a year without having a period. And because of this, many women, when the hormones are out of balance, they can also begin to gain weight. They can start to develop elevated blood sugar. Also, we start to see that the levels of male hormones become higher in the body relative to female hormones because you're really not ovulating to create your female hormones. So with these extra male hormones, we can see added hair growth on the body as well. This can be around the chin. It can be on other parts of the body as well. Some people can also start to develop dark patches on their skin, and this can be related to the hormones that are out of balance. So many people ask, well, what if I don't want to have a baby? Or maybe I think it's a good idea that I'm not having a period and I never thought about that this is a problem. But we know that this is, your period is your monthly vital sign. So if you're not having a regular cycle that's mostly pain-free, that's of low flow, then we know that there's something metabolically and hormonally going on with your body. So if you don't have a period in a couple of months, don't take this as a sign that I don't have to worry about it. Take it as a sign that you need to get your body in balance because the long-term consequences of polycystic ovarian syndrome. So number one is not being able to conceive, right? For many women who that's an issue. But we also see issues with diabetes and prediabetes. We know the risk of diabetes goes up to double for women that have polycystic ovarian syndrome. For women that do get pregnant and have a baby, the risk of gestational diabetes is going to go up. The risk of, again, weight gain and insulin resistance. And then we can start to see the heart disease risk that goes up. Because if your hormones are not optimally balanced, then the risk of having a heart attack is going to be much higher. So that's another thing to consider why you want to get diagnosed with PCOS if you have it, but also get some treatment for it. Also, we see a greater risk of endometrial cancer. So the endometrium is the lining of your uterus. And so the uterus is meant to be balanced by estrogen and progesterone. So if you're not having a regular cycle, what can happen is that bleeding is not leaving your body. You can get an overgrowth of the cells within your uterus, and that can make you more prone to have cancer on the uterus later on. We also see higher risk of anxiety and depression in women that have polycystic ovarian syndrome. And the other is elevated risk of sleep apnea. Now, this often comes from the weight gain that comes with polycystic ovarian syndrome. Now, a lot of people will say, well, I'm having these symptoms. I'm gaining weight. I'm not able to get pregnant. But my doctor tells me everything is fine. So one of the misconceptions that we have, even in medicine, is that to make a diagnosis of polycystic ovarian syndrome, that you need cyst on the ovaries. Now, yes, I know it's in the title, but in medicine, we just haven't gotten around to changing the title yet because all women don't have to have cyst on the ovaries to make the diagnosis. So you can have this diagnosis simply by having irregular cycles and by having signs of additional male or androgen side effects. And this can be the hair growth that I spoke about. And the third criteria now we have is for the cyst on the ovaries, but you don't have to have that. But the role of the Endocrine Society is really looking to change the diagnostic criteria and removing the ovarian cyst, because we see many women that will have the extra additional male hormones, but many women will have polycystic ovarian syndrome, but it's related to excessive insulin levels. So then how do you really get a diagnosis for it? So of course, if you haven't had a period, you want to start with an ultrasound. You want to see if there's anything structurally going wrong within your pelvic organs. But then when you have blood work, you do want to measure your hormone levels. So you want to measure your levels of estrogen and progesterone, but you also want to measure, and within the criteria are the hormones called LH and FSH. So these are signals from our brain that can then go down to our ovaries, and those can be out of balance when you have PCOS. You also want to measure your blood testosterone levels, because for many women that level can be elevated. And also you want to get a blood insulin level done. Now I find a lot of women aren't getting an insulin level done. They're actually just having a hemoglobin A1C level done to check their blood sugar. But an A1C really is only reflective of diabetes or prediabetes. But many women with PCOS have insulin resistance, and it can be 10 years or more before they actually have a sugar-based issue. So you want to get the insulin level done and the blood sugar level done. And then you want to calculate a score called HOMA-IR, because this is a measurement of insulin resistance in the body. Okay, so that's how you go about getting a diagnosis for PCOS. And then what about treatment? So then how do you manage it? Because in medicine, typically what we do, if you come in and you're not having a period, many doctors will say, let's just put you on the birth control pill. It's going to help to regulate your cycles. Now, the birth control pill can help with PCOS because it is giving you some synthetic estrogen and progesterone, and it's going to promote the lining of your uterus to shed, okay? But it's only masking symptoms because it's not getting at the root cause of the PCOS. So for example, if you have insulin resistance, the pill is not going to help you with that. And even if you go, so metformin can be another treatment. Metformin is a medication that we use for diabetes management or for insulin resistance. And it can help with PCOS, but you want to dive even a little bit further than that. Because many people are put on metformin for PCOS, and they're not really given the discussion to talk about lifestyle management, about nutrition, about stress, the impact that stress has on cortisol. So we really need to dive a little bit deeper so that women understand, let's get to the root causes of this. So we want to look at medications and supplements that can actually help to overcome insulin resistance. So a natural form, if we can call it, of metformin is something called berberine. And berberine has been studied and showed to have benefit in women that have polycystic ovarian. We also know the supplement called myo-inositol. So this is a supplement that can be taken that's advocated that can also help for women to overcome the symptoms that they have with PCOS. We also know the importance of exercise and movement. So exercise is not about the weight loss part of things. So exercise is about activating the mitochondria. It's about activating the hormonal mechanisms within the muscle cells. It's about sending the signal to the liver to get rid of sugar in your blood so that you can lower the sugar and improve the metabolic benefits within your system that exercise alone can help to do. So those are some of the lifestyle and treatment strategies that we have. We also will sometimes think about hormonal management depending where a woman is kind of in their life cycle of reproductive cycle. So for example, if I see a woman that she's in her early 20s and she's having irregular cycles, we're really going to want to manage things to get her cycling regularly because she wants to improve her fertility as much as possible. If I see a woman that's 45 and she might have just always been knew that she had irregular cycles and no one really investigated it, or maybe she was on the birth control pill, but she decided to come off of the pill because her husband had a vasectomy, then I will screen those women as well for PCOS because we really want to get at those underlying factors. And a lot of those women that are in their mid-40s, that'll be an early sign that I will get them started on progesterone. Progesterone is something that we can use for PCOS, for irregular cycles. We can use progesterone for perimenopause as well. And so as you can see, the hormonal cascade for women is not simple. It's not easy. So really speaking with a practitioner that really understands it is super important, because we don't want to just band-aid anything. Whenever our body is always speaking to us, and if we're not having regular cycles, there's underlying mechanisms that we really want to get at, whether you're 20, whether you're in your 40s, because we want to, again, get our body sending us the best hormones that it can. And if you are in your late or mid 40s and you're going to be going into menopause, you want to really take control of your life now so that you can really make the menopause transition as easy as possible, because it is easy to go through menopause if we can get a lot of these right steps in place when we're earlier on in our 20s and 30s and early 40s. So I hope that makes sense to you. And again, this is PCOS month. We're here to raise awareness about this condition. We want to understand it. There's still things that science doesn't understand completely, but we know that many women are able to reverse their PCOS, that are able to go on, that are able to have good fertility, and there's many women that are able to reduce their symptoms so that they go on to reduce their risk of diabetes, heart disease, and endometrial cancer. So if you want more information, please feel free to reach out. I'm here for you. I do have some programs coming up. They'll be announced in the month of October, where I'm going to be offering weekly support for women that are going through hormonal transitions. I really feel that even a one-time assessment with a practitioner is not often enough, that we need more support, and that's what I'm going to be able to provide within the group environment. So I hope this has been helpful for you. If you have any questions, please drop them in the chat, and I'd be happy to do another post and discuss a little bit further about them. Have a wonderful day, everyone. Bye for now.